Carolyn, and I am going into my 4th and final year at UVA, and I study global public health and biology, and I'm from McLean, Virginia, so I see a lot of in-staters here. And yeah, during the year, I work as a peer health educator within the Office of Health Promotion at Student Health, and I'll speak on that a little bit further into the presentation. But yeah, this summer I'm also interning for Student Health as well. So I will go ahead and pass it along to Tia to introduce herself.
Hi, everyone. My name is Tia, and I'm an associate director in the Office of Health Promotion part of Student Health and Wellness. And so I help coordinate substance misuse prevention, intervention, and recovery support across the university. So we are so happy that you're here and can't wait to welcome you. And I will pass the intros to Sarah.
Hello, everyone. I'll echo what Tia was saying about we're happy to have everyone here, and we're glad that you were able to come to this today. My name is Sarah Humphreys, and I am the Assistant Director of the Student Disability Access Center. I work really closely with students to help implement accommodations in their classes. And I'll pass this to Mark.
Hello. I'm Mark Keeley. I'm a physician here at UVA Student Health and Wellness. I grew up in Roanoke. I saw someone from Roanoke on the call. And then I came to UVA for my undergraduate degree and then my medical degree. And after that, I went to Pittsburgh, Pennsylvania for my family medicine residency. And like a lot of other folks who graduated from here, came back to the Charlottesville, Albemarle area and then practiced out in the community for over 20 years. Before coming here to Student Health and Wellness Medical Services about 4 years ago. So as an alum and faculty member, I want to welcome all of you. And I'll pass it on now to Kelly Gildersleeve.
Hello, everyone. I'm Kelly Gildersleeve, and I am the Billing and Insurance Manager here in Student Health, and I've been with UVA for a very long time. I'm glad to be part of the Student Health team for a couple years now. And we'll talk to you in a bit about insurance and some deadlines. Oh, passing on to Tabitha.
I don't know if Tabitha is.
I know she was in and out, but Tab Enoch works with orientation, and so I know she's bouncing around to different sessions, so she might pop in and out. So yeah, so I think we're good with introductions. Take it away, Carolyn.
Alrighty. So just a quick icebreaker, and you guys can drop this in the chat to everyone. But which famous author do you think was denied acceptance from UVA? And you can just put the letter next to their names. I don't know if this is bandwagon effect, but I'm seeing a lot of C's. Any other answers that you all have? Okay, it's looking like C, which is the correct answer. So yeah, Dr. Seuss was denied acceptance from UVA, and rumor has it that the name for the town of Whoville in The Grinch by Dr. Seuss was a pun off our mascot, the Who's. So you're just learning something new about UVA every day. And yeah, just to give a brief introduction to what we're doing here today. So this session is kind of a quick, broad overview of student health and wellness, and then we'll have some time to answer questions that you might have at the end. And in just a moment, Sarah is going to change the chat settings so that your questions don't go to the whole group, but only to us facilitators. So you can direct your questions to any of us. And we'll go ahead and read them out, but of course keep it anonymous and not say your name and the question that you asked. And then yeah, just when asking your questions, please keep in mind these points up on the slide. So making sure that your questions are relevant to the general group, and of course not disclosing any personal health information And if you do have some questions that are maybe more personal or cover topics that you aren't comfortable asking today over Zoom, just feel free to use the student health and wellness email address listed here, or give us a call and someone would be happy to speak with you. All right, so moving on to kind of why I'm here today during your orientation session. Like I mentioned before, I work as a peer health educator within student health. And my job is kind of to provide and support fellow students with information about a wide range of health topics, from stress management to alcohol safety to nutrition and sexual health. And so I do a lot of outreach presentations to certain student groups and dorms. So you may see me in one of your halls in the upcoming year. But then I also do some one-on-one sessions with students, where we just have a super casual conversation about their health, things that they'd like to work on, whether it's, getting more sleep and certain habits that they can form to do that, or just talking about, how they're doing with their stress management, that type of thing. So through my training, I spent a lot of time in the student health and wellness building, and I've gotten to know the providers and employees at student health and wellness pretty well. But yeah, I just want to kind of talk to you about, like it says, a student perspective on student health and wellness. And even before becoming a peer health educator, and becoming more familiar with student health, I've always felt so comfortable and was just surprised by the sheer amount of services and resources that, the team at Student Health and Wellness would discuss with me. Going into college, I think back to 3 years ago, where I had this new level of independence and I had to learn to be in charge of my own medical care. And that can seem scary to some people. It can feel difficult to navigate, but can also be super exciting that you get to seek out your own care. But there are so many people just in student health and wellness and all around the university that are willing to help. You know, I was even confused by how I would pay for certain appointments, because I had a physical checkup my first year and I was running around student health trying to figure out where I'd pay my copay. And, you go to one person, you ask that question, and they're always going to lead you to someone who can help. And so that's something that I really want to emphasize today, is that there's always someone anywhere at the university that is willing to help out. And also just, it's called student health and wellness for a reason. There are a lot of components to student health, but each team, whether it's the medical services team or the counseling services that we have at student health, they're all working to, make sure that you are happy and healthy and can make the most out of your college experience. So they take a very holistic approach and, want to incorporate not only your physical health, but also check in on your mental well-being as well. So I'm going to speak about some of those resources that we have on both sides of student health and wellness. So yeah, to just kind of touch on the physical health component of things and the medical services team, I can kind of share some of my experiences with you. And again, if you have questions later on, feel free to just private message me through the chat function, and we will get to those at the end. But yeah, health can kind of be, personal, somewhat sensitive thing to discuss, especially when you're not used to, again, this new level of independence that comes with college and navigating a health system on your own without maybe a parent or a guardian for the first time. But, these providers at Student Health and Wellness make you feel so comfortable and heard when you're with them during appointments, whether it's telehealth or in person. And, it's their job to speak with college students on a daily basis, and they know the struggles that come with college. It may feel weird talking to them about certain things like your mental health or, your sexual health, but these are things that they are trained to discuss and treat. And, they love speaking with college students about, these health topics, and they're there to support you and help you out with anything health related. And so again, it's their job to talk about these things with college students, and they're more than happy to do it. And another thing, just logistics wise, because this is something that I was somewhat, confused by when I first became a student at UVA. It is super, super easy to make appointments. This may be your first time having to make appointments for yourself to go to a doctor's office. But you just go through, and I want to emphasize this again, if you're going to take one thing out of this, know that we're here to help. And the Healthy Who's portal is your best friend when it comes to student health and wellness. So the Healthy Who's portal is essentially exactly what it sounds like. It's a portal that you sign in on with your net badge. And you've probably already submitted your pre-entrance health form through this portal. But it's where you can make all of your appointments, and you can pick the provider, you can pick the certain office that you're seeing. And it's where everything is, whether you're going in for a checkup, or you're getting a prescription, or you're going to counseling services in student health. It's all in the Healthy Who's portal, and it's super easy to follow up with the provider that you met through this portal as well. And then to speak on kind of the wellness side of things, so maybe more mental well-being. As a first year, I attended these outreach presentations by Peer Health Education, and I went to, events held by the counseling and psychological services team. They would always advertise the mental wellness screening day, which is one day where the entire counseling team will sit down and just have students come in, walk in appointments, and talk to you about their mental health. So it's kind of like, you go for a physical checkup. Why wouldn't you do that with your mental health? And it's just an open conversation with someone from their team, and they may give you recommendations, or they're just a listening ear. And you can see kind of underneath this Peer Health Education logo, it says positive, inclusive, empowering. And that's kind of the motto of Peer Health Education, but also all of student health. They just want to help you and empower you with information so you can make decisions about your own health. So learning about the resources that we have, and just knowing that information allows you to make an informed decision of what you're going to do next, whether you're going to go to this follow-up appointment, or you're going to, seek counseling from this place. And again, it's just, they're working with you. They're not telling you what to do. And you're very much involved in kind of managing your own health. And it is really empowering. And again, there's no shortage of people that you can reach out to. But sometimes the choices can seem overwhelming. So looking at the Student Health and Wellness website is a great starting point for everything. Also Healthy Who's portal as well. But from the website, you can find information about the counseling services team. You can find information about the medical services team. Then a bunch of like wellness, well-being guides, and Wahoo Well, and Peer Health Education. And again, these appointments are also made through the Healthy Who's portal. And, another thing that I want to touch on is that, we are a super inclusive group, not only Peer Health Education, but all of student health and wellness. And so these services are available to everyone, and we want you to use them because they're great. And even if you don't have the specific UVA sponsored Aetna insurance, which Kelly is going to talk about, you can use almost all, if not all, of the services provided by Student Health and Wellness. And with that, I'll go ahead and pass it along to Tia.
Yeah, so thanks, Carolyn, for giving us your student perspective. Always helpful kind of a day in the life of a student and what that experience and portal is like from the student side. As Carolyn mentioned, we're here for you, and that means all of you. So we're committed to treating with respect everyone, all persons, regardless of age, disability, gender identity or expression, national origin, race, religion, sex, and sexual orientation. So that inclusivity piece is very important to us. We want all students to know that they belong at UVA and that we care about each student's experience and what's going on with them. And so, yes, like Carolyn said, if there's one thing we want you to take away, it's that we are here for you. And so the next slide is that we're also here for you geographically. So these are kind of stock photos of our brand new student health and wellness building. It is going to be ready ASAP. We are hoping for before classes start, but we'll see, fingers crossed. But definitely feel free to come by, stop by, just say hi, check out our spaces. That bottom right picture is a picture of our new teaching kitchen, where you can come and take cooking classes and learn about that. There's also going to be hangout spaces in this building, so student lounges, and I think there's a fireplace in there. And so we really want it to feel like you're home. So like I said, it's probably a 15-minute walk from the rotunda. There is a bus stop that is right at the corner of the street that the building is on. So it's very easily accessible to students, even if you don't have a car, that you can walk, take the bus, that kind of thing. And the hours are Monday through Friday, 8 to 5, but there is always 24/7 access to like on-call phone numbers and things like that. So just know that we're here for you in that way too. And we're here for you for all the things. So this is just a summary of some of the services that we provide. As Carolyn said, we are student health and wellness. So you'll see a lot of medical services on here. That is certainly one of our units within student health and wellness. But you'll also see more things that are health promotion focused through our Office of Health Promotion, bystander education, sexual harm prevention, substance misuse prevention, our peer health educators that Carolyn is a part of as part of health promotion. We also have, Carolyn mentioned, our counseling and psychological services. So you'll hear the CAPS acronym a lot. And so they provide individual therapy, they provide group therapy, and it's amazing the number of groups that they offer for different folks. I think it was something like 15 to 20 groups that they have. So more than likely you will be able to find a group that applies to you and that feels relevant. We have nutrition services, and our teaching kitchen is a part of that, but we have registered dietitians. As Carolyn mentioned, sexual health, contraception, women's health, travel health. If you're planning on traveling and need certain, vaccinations or want to consult about that, we have that. We also have, under student health and wellness, is our Student Disability Access Center. So you might hear SDAC. UVA is big on acronyms. And so if you hear SDAC, that is our Student Disability Access Center. They provide disability related accommodations. They are great advocates for students, outreach. They can help you communicate with your professors. They can help with assistive technology, lots of things there. And then let's see if med services, Office of Health Promotion, SDAC, CAPS. Who am I missing? Am I missing any of them? The different units under student health and wellness. And so also for any of our units, if you do need to be referred outside of UVA Health for whatever reason, we have care managers in each of these units who can work with you and discuss with you about community options, whether that's in Charlottesville, but also back in your hometown. They can help provide those connections and help help you make those bridges to external support. So that's not something that you have to figure out all your own. And we also have a laboratory, so we can do lab testing. We have a pharmacy, so you can pick up your prescriptions there. So hopefully you take away that there's a lot under this umbrella of student health and wellness. And again, we want to focus on your holistic health and well-being. And so if you have any questions about what we provide or how we provide it, please don't hesitate to reach out. And then I think the next one, I'm going to hand it over to Kelly.
Thank you, Tia. So we are part of the administrative area. The insurance and billing area is part of administration. So that wasn't mentioned, but we also were here to help you and as a resource to assist with things like insurance and questions on your bill, walkout statement that you receive from Healthy Who's portal. So that sort of thing, we're here for you. Your fees that you pay with tuition, called comprehensive fees, include something called student health services, which is how you are paying for your visits to student health and wellness. So there aren't any co-pays to see a provider when you come to student health. That's covered. There may be some costs when you have your visit that are related to like labs or vaccination or something like that, but the actual visit is no cost. It's covered by those fees. So as Carolyn mentioned, you know, there's this idea that you have to be on the Aetna student health plan to be seen in student health, and that's not true. It's for every student at UVA that is a full-time student paying those comprehensive fees with tuition. And the things that it covers are listed on the screen: professional visits, counseling, psychiatric treatment. Tia had mentioned already a lot of these kinds of services, but there's so many programs, there are so many ways that we can assist you in different things like traveling or just having better overall health and, you know, getting you connected with groups that, and that's all part of the fees that you already pay. So it's good to take advantage of all of that. At the bottom of the slide, there's a website that shows the charges that you may incur when you come to visit student health and wellness. And again, that's for vaccinations or for medical supplies or any lab work that might be done during that time frame. So it's updated all the time, and we keep that up to date and point to it when you come. So there are a bunch of deadlines that you've been notified of, and they're to-do items in your student information system. One of those is the COVID vaccine requirement. That deadline has already passed. A big question that was asked in our first session was, can you upload the first vaccination, proof of vaccination in Healthy Who's, and then once you get the other one, if it's after July 1st, can you upload that second vaccination? Yes, you can do that. Absolutely. And we would encourage that, but it won't get rid of the hold on your SIS account. So that's going to remain there until that requirement is met. So that's the COVID vaccine requirement.
Kelly, can I jump in here with a question that we've got around that?
Sure.
If students did not send in their proof of vaccination until after the deadline, how do they know that UVA has received the proof of vaccination and that their card will be reactivated?
The card will be reactivated. So if the hold's been removed, then you know that it's been completed, right? So SIS will show that done. If you have specific questions about that, our medical records area kind of manages the COVID vaccine requirements. So you could contact them. There's also a link on this page that talks about vaccinations, that a lot of FAQs are put on that page to answer a lot of questions that you have. So everybody's going to have a unique question. We're all individuals. So I would encourage you to look to those resources. And
one general comment I'll make is that medical records has stated that it may take up to 5 days for them to process all this. So I know we're all used to kind of immediate results, but they're dealing with a lot of information, just so you know that. So try to be patient. Again, look at the FAQs that Kelly mentioned, and but yeah, go ahead and send it in, and you can again look at your account and see. But if you have any questions, yeah, I would look at those sites and get in touch with medical records if you needed to. But do give them that time to get that stuff processed.
Because in addition, medical records is also managing the pre-entrance health form, which was the next to-do item on the list. That deadline is upcoming. There are always questions about that, but it's addressed on the website. There is a link provided, more information here. You're welcome to look at that. That's basically a record of your vaccinations that you need to get by your provider if you have a PCP at home. Just to get all that. And there are things that are required here at UVA for you to be a student and live amongst this community. So that's why we have the pre-entrance health form. That's due on August 1st. And then last but not least, health insurance verification is right around the corner. Next Monday, it will open up and the insurance verification process will begin, where you can provide your insurance information to us, or you can enroll in the Aetna Student Health Plan. There are 2 different options this year, meaning 2 different premiums, I should say. If you're new to the student plan with Aetna, then your coverage will begin August 1st, and the premium is $3,148. If you are already on the Aetna Student Health Plan and you're going to re-enroll again for the 21-22 academic year, then your coverage is going to pick up where it left off, or will leave off, August 14th of 2021, and that premium will be $3,027. Both plan years are going to end July 31st, 22. So we're lining up both to end at the same time. And this is to help provide a better date coverage for when you go to graduate and be employed with an employer, because typically their employer plans begin at the first of the month. So we've got a little bit of a date change happening this year. Again, resources are available. There's the link provided, the middle link, Student Health Virginia, the insurance information. There are deadlines posted there. There are premiums posted there. Our actual site to take action will open up on Monday, July 19th, and you'll receive numerous notifications about needing to complete this on your to-do list. And once it's complete, it will disappear from your assist to-do list. Again, as Mark mentioned, it can take a few days for us to update that. So patience is appreciated very much as we go through the process. So many students here all doing the same thing, and we are going to try to keep up with that. So thank you for your patience in that. And I think, so yeah, the main message that we want to provide to you is that we're here for you. We're here for you in all capacities, whether it's administrative, medical, mental health, groups to connect with. There's COVID questions that we have had for the past, seems like forever now. year and a half plus, and we have addressed a lot of those questions on our website, and there's numbers that you can call for specific questions that you might not find on those sites. But we're here as a resource. You can call us, you can email us, and we're here to help. So welcome, and we look forward to meeting you. I think that's it for me.
So this is the section again. I've been getting some questions, but again, you can feel free to send them to any facilitator at this point, and we will get them answered. And if for some reason, because there's a lot of chat activity, if we have not answered it, feel free to send it again.
Yeah, I just want to echo just what everybody else has been saying, and from Carolyn to the rest of the group, that the bottom line is, yes, we're here for you, and we care about you, and not just your medical condition, but it's really we do practice holistically, and we do want to focus on wellness and prevention, but we're here also for the illness treatment and care. So as Kelly mentioned, we're here for every student, and that and if it's just starting with us, we can certainly talk with you and get you in the right direction. As Carolyn also mentioned, we're here to help, and then whether that's also for wellness questions or prevention or medical care. So please come to us. We're here. We are here for you, as everybody has said, and we're very excited about our new building, and we can't wait to get in it, and all the different things that we're going to be able to do in there. But it's just down the street from where we are currently. So come see us.
We've got one question in here. So if I'm prescribed a medication by my hometown doctor, can I get that through UVA Student Health?
It's going to depend on the kind of medication. There are some medications that we do not prescribe here, and again, that might be something to check separately or check in with. There are some medications that we don't prescribe here. Our pharmacy, I know we've had questions previously about pharmacies taking over. Our pharmacy may be taking over a prescription that's a regular medicine, and again, our pharmacy can take those prescriptions, and information should be on the website about that. And if there's any questions, just call. But if there's specific medications that you're wondering about, I would call and ask about.
Okay, what other questions do folks have? I don't think I have any other ones on my. So maybe what we can do, some of us can stay on afterwards, just in case folks have any other questions, but otherwise, thanks so much for joining us. Don't hesitate to reach out, and we are so looking forward to meeting you and seeing you in the fall. Thanks, everyone.
Take care. See you soon.